8:30 on Monday night, the latest ambulance joins the queue outside Accident and Emergency. There are 5 in front. Some have been sitting for more than 45 minutes, and crews know they could be here for several hours.
So the longest wait is this lady here. She's at 4 hours 4 and she's waiting to get seen.
Inside the waiting room is also busy, and the emergency department is full.
The situation's pretty grim, unfortunately, just now. Not an exceptional occurrence, I'm afraid to say. We're short-staffed, there's no beds, we're certainly up against it once again. I mean, just yesterday across Lanarkshire there was about 600 patients presented requesting accident emergency assistance yesterday across the 3 hospitals in Lanarkshire. Only 60% of them were seen, assessed and either admitted or discharged within 4 hours. Below 60 on some days, below 50 on some days, and unheard of numbers in the past. That's what's happening. The whole system is broken.
Colleagues off sick or self-isolating mean rotas are hard to fill. Nursing staff here say they pride themselves on being resilient, but now they're at absolute breaking point.
We deal with the sickest patients first, and unfortunately that means patients are going to have to wait. And it's just 18 months ago the public were clapping for us, and now they're screaming and shouting at us, and racial abuse has increased, verbal abuse has increased, physical abuse has increased in our department. And it's really difficult. You feel as though you're failing.
COVID is not the main issue here. There are currently 55 positive cases across Lanarkshire's 3 hospitals, only 6 at Hairmyres. On top of emergency patients, those waiting to be seen include the chronically ill, those directed here by NHS 24, or many with minor injuries. 5 hours after she arrived, Mary FARRELL is still waiting on test results. The 76-year-old had a fall and has chest pains.
I twisted my ankle last night and it was all swollen, and so my neighbour brought me up. Taking it in because my heart wasn't very good. If a place is busy, it's busy. As far as I'm concerned, the girls are not doing their best. And
one of the biggest things that we hear from patients is, I can't get through to my GP, or I'm not getting an appointment, so the fallback is to come to ED. I can understand patients want to get seen, but our EDs cannot be overwhelmed by the worried wail.
The Scottish Government acknowledged this significant challenge ahead of the publication of its NHS recovery plan.
One of the things we need to do, and this is not easy, to get pressure on A&E down, is to get primary care services back to normal so that people have more face-to-face interaction, because sometimes people will end up in A&E because they don't have the ability to see somebody elsewhere, and there's a programme of reforming urgent care underway right now.
Upstairs on a ward, they have 10 patients waiting to be admitted from the emergency department and only 2 free beds.
Combined with nursing shortfalls, this is a bit of a nightmare at the moment. I've been nursing for 34 years and I would say this is one of the most difficult times that I've come across. We're going out to bank and agency to fill shifts that we would never have done in the past. And we still can't get enough staff.
Thank you. Today I should be working with 9 registered nurses and I'm working with 7, including myself. So, and that's just in the registered front. From a clinical support worker's point, we're short 2. It's just at this point where I think there's only so much we can do now.
To respond to this need, NHS Lanarkshire has a 24-hour wellbeing service offering dedicated support for staff.
One of my colleagues resigned last month. One of the trainee doctors who just started recently has quit. I wouldn't be surprised if other people follow that.
I've had 5 nurses quit and resign in the last few months. I've got more nurses that are handing in their letters of resignation, and we are trying to recruit more nurses at the moment. We're really, really exhausted, and I'm terrified of what's happening in the winter.
The NHS recovery plan is out tomorrow. Here they warn the challenges are growing day by day. Sharon Frew, STV News.